the past 6 months to a year, especially in the Middle East, a region that you know so much about. But let's talk first about your focus here at CGI. You're talking about creating new ways to attack poverty, to attack disease with an emphasis on women and children. Let's start there. How do we do that?
Well, we had some interesting commitments this year about what we tried to do was to argue that if you think of doing it in the first place, if you design these programs from the outset to deal with the shortage coming to the past, you get better results. It's a lot better than fixing them later. And that's true in the private sector as well as the public sector. So we opened up with the new president of the World Bank, Jim Kim, who was a partner with Paul Farmer and Partners in Health. And he talked about how to design good health systems that take account of the needs of women and girls. When I started working on AIDS, the thing that astonished me all over the world was in poor countries, you go one place to get your AIDS medicine, one place to get maternal health, another place to be treated for malaria. There was no system. So we started building healthcare systems for people where you go one place and everything can be taken care of. And we had an interesting commitment this year by a group called Delos, which is a great NGO, talking about how they would work in America to redesign workspaces to solve health problems before they created, to make them healthier in the beginning. We have a lot of commitments this year working on training and preparing women for the workforce wherever they exist in their countries. And GAP, for example, has done a really interesting thing in some of their Asian workforces, going right into the factories and training the women about how to handle their finances and how to move up into management.